There's something we all do every single day without even thinking much about it. Our personal hygiene. Brushing our teeth, washing our hands, maybe even that quick splash of water on the face in the morning. But here's the thing. As we get older, some of those little habits we've had for years might not be serving us as well as they used to. And sometimes, doctors notice these things right away. Things we might not even realize we're doing. So today, let's talk about 7 common hygiene mistakes that many of us make after 60, and how fixing them can keep us feeling fresh, healthy, and confident. Stick around. Number 4 might just surprise you. Now, I know what some of you might be thinking. I've been taking care of myself for decades. What could I possibly be doing wrong? Well, here's the truth. Our bodies change as we age. Our skin gets thinner. Our sense of smell might not be as sharp, and even our mouths don't produce as much saliva as they used to. These changes mean that some of the habits we've relied on for years might need a little tweaking, and that's okay. The goal here isn't to criticize, it's to help you feel your best, so you can keep enjoying life to the fullest. Let's start with something simple but super important. How often you're bathing. Now, I know some folks who swear by a daily shower, rain or shine. Others might cut back to every other day, especially if the weather's cold or their skin feels dry. But here's what doctors notice. Bathing too much or too little can both cause problems. Overwashing, especially with hot water and harsh soaps, can strip your skin of its natural oils, leaving it dry, itchy, and even cracked. On the other hand, skipping baths for too long can lead to buildup of bacteria or even infections, especially in areas like folds of skin or feet. So, what's the sweet spot? For most seniors, a lukewarm shower every other day with a gentle moisturizing soap is perfect. And on the off days, a quick sponge bath for those key areas, the ones, can keep you feeling fresh without overdoing it. Oh, and here's a pro tip. After your shower, pat yourself dry, don't rub, and apply a fragrance-free moisturizer while your skin's still slightly damp. This locks in moisture and helps prevent that annoying winter itch. Simple, right? Next up, oral hygiene. Now, this is one area where doctors and dentists can spot mistakes from a mile away. And I get it. Flossing can feel like a chore, or maybe your gums bleed a little, so you avoid it. But here's the thing. As we age, our risk for gum disease goes up, and that's not just bad for your teeth. It's been linked to heart problems too. So let's break it down. Brushing twice a day is a must, but are you using the right toothbrush? A soft bristled brush is gentler on aging gums. And flossing? If traditional floss is tricky, try a water flosser or those little floss picks. They're easier to handle. And don't forget your tongue. Bacteria love to hide there, and a quick scrape can make a big difference in your breath. One more thing. If your mouth feels dry a lot, maybe from medications, ask your doctor or dentist about a saliva substitute or sugar-free lozenges. Dry mouth isn't just uncomfortable. It can lead to cavities faster than you'd think. Let's talk about something we might not like to admit, but is totally normal. Paying a little less attention to our feet. Maybe bending down is harder, or we just don't think about it. But doctors notice when feet are neglected. Thick nails, cracked heels, or even small cuts that could lead to infections. So here's my challenge to you. Once a week, sit down with a mirror and check your feet. Look between the toes, under the nails, everywhere. And if trimming nails is tough, try a long-handled clipper or ask a family member for help. Your feet carry you through life. Let's give them some love. We've covered bathing, oral care, and foot care. 3 big ones that doctors notice right away. But there's more to talk about, including that surprising number 4 I mentioned earlier. So take a quick stretch, maybe grab a glass of water, and I'll meet you back here in just a moment to keep the conversation going. Welcome back. Now, before we dive into the next few hygiene habits, I want to share a quick story. A friend of mine, let's call her Betty, went to her doctor for a routine checkup, and the first thing he noticed wasn't her blood pressure or her knee pain. It was her skin. Specifically, how dry and irritated it looked. And you know what Betty said? "Oh, that's just part of getting older." But here's the truth. While some changes are normal, others are signs that we might need to adjust our routines. So let's keep going with these hygiene habits, because sometimes the smallest changes make the biggest difference. All right, let's talk about skincare. Now, this isn't about fancy creams or anti-aging serums. It's about the basics. Doctors often notice that seniors either over-moisturize, slathering on thick creams without letting the skin breathe, or under-moisturize, ignoring dryness until it turns into cracks or even sores. Here's the fix. After washing your face or hands, apply a light, fragrance-free lotion while your skin is still damp. And for those rough patches, elbows, knees, heels, a thicker ointment like petroleum jelly works wonders at night. Just remember, if your skin feels tight or looks flaky, it's begging for hydration. Oh, and here's a tip you might not expect. Don't forget your ears and neck. These are spots we often miss, but doctors notice when they're dry or neglected. A quick dab of moisturizer there can keep everything feeling smooth and healthy. Now, let's move on to hair care. And this is where I might step on a few toes, but bear with me. Many of us stick to the same shampoo we've used for 30 years, even if our hair has changed texture or thickness. Doctors and hairstylists spot this right away. Harsh shampoos stripping thinning hair, or buildup from heavy conditioners making scalps itchy. The solution? Switch to a gentle, sulfate-free shampoo, and if your hair is dry, try a leave-in conditioner or even a light oil like argan oil on the ends. And here's a golden rule. Wash your hair based on its needs, not just out of habit. For some, that might mean twice a week. For others, every few days. And while we're on the topic, brushes matter too. A soft bristle brush or a wide-tooth comb is easier on aging hair and scalps. No more yanking or breaking. Okay, are you ready for the one doctors say shocks their patients the most? Here it is. Not cleaning hearing aids or glasses regularly. Now, I know, these aren't hygiene items in the traditional sense, but think about it. Hearing aids sit in your ears all day, collecting wax and moisture. Glasses? They're constantly touched by your hands, then smudged onto your face. Doctors and audiologists can spot a dirty hearing aid or smudged lens from across the room. So here's the game plan. Wipe your glasses daily with a microfiber cloth, not your shirt, and clean hearing aids with a dry brush or cloth as recommended. For heaven's sake, don't use water. It can ruin them. This tiny habit takes seconds, but makes a world of difference in comfort and health. Fun fact, clean glasses can even reduce eye strain and headaches. Who knew? We've covered so much already: skincare, hair care, and those surprising glasses and hearing aids. But there are still a couple more habits we need to chat about, including one that could affect your independence in a big way. So, take a quick break if you need to, and I'll meet you right back here for the final part of our conversation. Welcome back, my friends. Now, we've covered some important ground together, from bathing habits to hearing aid care. But before we wrap up, there are two more hygiene essentials that doctors wish every senior knew about. And I'll let you in on a little secret. Mastering these last two could be the difference between staying independent or needing extra help down the road. Let's dive in. First up, hand washing. Now I know what you're thinking. I've been washing my hands since I was 5 years old. But here's what doctors notice. Most of us aren't washing thoroughly enough or often enough as we age. Our immune systems aren't what they used to be, which means germs hit us harder. The trick? Wash like a surgeon. Warm water, plenty of soap, and scrub for a full 20 seconds. That's about 2 rounds of happy birthday in your head. Pay special attention to those fingertips and under nails where germs love to hide. And here's a pro tip. Keep moisturizing hand soap by every sink in your house. That way, you'll avoid dry skin while staying protected. Oh, and carry alcohol-based sanitizer when you're out. But remember, it's no substitute for good old soap and water when you can get to it. Now for our final point, and this one might seem surprising, your laundry habits. Doctors and home health nurses often notice when clothing or bedding isn't being washed properly. As we age, our skin becomes more delicate, and detergent buildup or infrequent washing can lead to irritation or even infections. Here's the golden rule. Wash bed linens weekly in hot water, and undergarments such as socks after every wear. Use fragrance-free detergents, and don't overload the machine. Clothes need room to get truly clean. One more laundry secret. Those sanitized cycles on modern washers? They're fantastic for killing bacteria in towels and bedding. And if you have arthritis, consider using laundry pods instead of measuring detergent. Much easier on stiff fingers. Now, let's take a quick moment to remember why all this matters. It's not about vanity or being fussy. It's about honoring the incredible body that's carried you through decades of life. Small tweaks to your daily routine can mean fewer doctor visits, more energy, and keeping that wonderful independence we all cherish. So let's quickly remember our 7 key points. 1. Finding that perfect bathing balance. 2. Upgrading your oral care routine. 3. Giving your feet some well-deserved attention. 4. Adjusting your skincare for changing needs. 5. Updating your hair care approach. 6. Keeping hearing aids and glasses fresh. 7. Mastering hand washing and laundry. I'd love to hear which of these tips resonated most with you. Drop me a comment below sharing your experiences or your own hygiene hacks. And if you found this helpful, do me a favor. Hit that like button and subscribe to Senior Life Secrets for more content to help you thrive in your golden years. Remember, aging isn't about decline, it's about refinement. Like a beautiful antique, you become more valuable with care and attention. Here's to your health, your happiness, and to feeling your absolute best at every age. Until next time, take good care of yourself. You're worth it.